Hello friends, today I will going to discuss the very important topic from pathology, and that is the apoptosis. So we all know that apoptosis is basically the programmed cell death. So what is apoptosis? Apoptosis is the programmed cell death when the cell is not required by the body, or when the cell is harmful for the body. The body has a defense mechanism to destroy it, and it destroy in a very programmed way, and the apoptosis is thus called the programmed cell death, or sometimes it is also called as the cell suicide. It is also called as the cell suicide. Okay, so this apoptosis can be physiological. Apoptosis can be physiological, which is most commonly seen. Physiological apoptosis is most commonly seen, and it occurs when the cell is no longer needed by the body, or when the cell is harmful for the body. The cell undergoes physiological apoptosis, and sometimes the cell is required by the body, but because some injurious stimulus destroy, or sometimes the injurious stimulus destroy the DNA of the cells, or sometimes the cell is injured by radiations, and such cells undergo apoptosis because of the injurious stimulus. Such apoptosis is called as the pathological apoptosis. Pathological apoptosis. And this is least commonly seen. The most commonly seen is the physiological apoptosis. So the examples are physiological apoptosis are seen in during embryogenesis or organogenesis. During embryogenesis or during organogenesis, we see the physiological apoptosis. So what happens during embryogenesis? When the hand is being made, suppose it is made like that, there is no cleft in the hand, so the apoptosis occur in these cells, and it forms the clefts in the hands, and these cells are not required by the body, and they are slowly undergo apoptosis, and in this way hand is being created like this, and the clefts are being found in the fingers and in the toes. So this is the example of physiological apoptosis, the embryogenesis during organogenesis. Okay, it is also seen when T cell is maturing in the thymus. So in the thymus, sometimes T cells are exposed against the body's own antigen present on the body's healthy cells. So if the T cells start destroying body's own cells, such T cells are not required by our body, and such T cells undergoes apoptosis, which is physiological apoptosis. That is, the cell is not required by the body. And sometimes during menstruation, when the product of conceptus does not reach the uterus, the proliferating endometrium thus does not support or nourish the, since there is no conceptor reaching there, so these cells are not required by the body, and they are shed in the menstruation. So during menstruation, the endometrial shedding is an example of physiological apoptosis. So physiological apoptosis is seen during embryogenesis. It is also seen during the maturation of the T cells, and it is also seen during the menstruation. These are the examples of the physiological apoptosis. And what are the conditions in which we see the pathological apoptosis? You can remember it by mnemonic Roach, where sees with the use of chemotherapeutic agents. With the use of chemotherapeutic agents like anti-cancer drugs, we see the pathological apoptosis. And with radiotherapy or radiation exposure, pathological apoptosis can occur. Also, when there is obstruction of the ducts, for example, when the duct of the pancreas get obstructed, the pancreas parenchyma undergo atrophy or undergo apoptosis. Okay, so we have the pathological apoptosis with the use of chemotherapeutic drugs, with the exposure to radiation, with the obstruction of the ducts of the pancreatic glands, or sometimes even the obstruction of the duct of the salivary glands can lead to the apoptosis of the salivary gland. And sometimes the graft versus host reaction can also induce the apoptosis against the host tissue. Even elevated temperature, for example exposure to sunlight or ultraviolet B light, can damage the keratinocytes and cause their apoptosis. Okay, so the example of pathological apoptosis, you can remember it as Croce, where E means the elevated temperature of the skin or some other tissue can cause the apoptosis. So another point you have to note here, that the pathological apoptosis is unprogrammed cell death. It is not programmed. It is the unprogrammed cell death. Unprogrammed cell death. While the physiological apoptosis is the programmed cell death. Okay. So apoptosis is generally the programmed cell death, which is also called as cell suicide, and apoptosis can be physiological as well as the pathological. Okay, the most commonly seen is the physiological apoptosis, and it is seen in the conditions with embryogenesis, with T cell maturation, and during menstruation. While pathological apoptosis is seen in condition with the use of chemotherapy drugs, with the radiation exposure, with obstruction of the ducts of the glands, in graft versus host disease, and with the exposure to ultraviolet rays or sometimes the elevated temperature can cause the apoptosis, which is pathological. Now we can now see how the apoptosis will be seen in the histology section. In the histology, how the apoptosis looks like. Histology of the apoptotic cells. Now we will study that histology. Okay, suppose this is the tissue section. This is the tissue section, and suppose we have the specimen of the apoptotic tissue. Okay, so suppose this is the normal cell and this is the nucleus of the cells having the chromatin. Okay, in the apoptosis, the earliest feature which we see is the shrinkage of the shall undergo shrinkage like this. This is the earliest feature of the apoptosis. If we find the cell is shrinkage in the cells, we must know that there occurs somewhere apoptosis occurring in the tissue section. Okay, if we see the cell is undergoing shrinkage, this is the earliest feature to appear. And the last feature to appear is the formation of the apoptotic bleb. If we find that apoptotic blebs is being formed in the tissue, it means apoptosis is occurring for quite a long time. It is seen in the late stage or the end stage of the apoptosis. This is the late feature and it is the earliest feature of the apoptosis. Okay, another characteristic feature of the apoptosis is that there occur the nuclear condensation, which is also called as the chromatin condensation, which is also called as the pycnosis. This is another feature of the characteristic feature of the apoptosis. It is the characteristic feature of the apoptosis. Characteristic feature. Okay, this is the characteristic feature of the apoptosis. So this feature is the cell shrinkage. In the apoptotic cells, we see the cell shrinkage. Cell undergo shrinkage. Another point I want to highlight here is that in apoptosis there occurs the cell shrinkage, while in the necrosis there occurs the cell swelling. Cell enlarges in necrosis, while cell becomes smaller in size in apoptosis, which is the earliest feature. This is the earliest feature. Then we also see the apoptotic blebs in the apoptosis, which is seen in the late stage, and we have the nuclear condensation or the chromatin condensation, which is the characteristic feature. Later this chromatin or the DNA sometimes dissolves and we see the DNA fragmentation. And this DNA fragmentation, when such tissues are placed in the agarose gel electrophoresis, when it is placed in the agarose gel electrophoresis, we find that DNA is fragmented in and it looks like the ladder pattern arrangement. like this in the agarose gel. So if we, in the tissue section, if we are seeing the cell are smaller in size, or the formation of apoptotic blebs, or there is nuclear condensation or chromatin condensation or DNA fragmentations, which is seen in the agarose gel electrophoresis, that points towards the apoptosis occurring somewhere in the cells. And another thing I would like to highlight here is that when these cells get destroyed, it is destroyed in a very sophisticated way, so that there is occurs no leakage of the contents of these cells. And it, when their DNA gets damaged, it forms the nuclear debris like this. And these nuclear debris are being formed because of the dissolution of these DNA, and also the cytoskeleton is being damaged, but they become loose, they do not totally damaged. And this loose cytoskeleton start engulfing these nuclear debris, and it forms the apoptotic bodies like this, without leakage of any content. And in the apoptotic cell, if we see the apoptotic section, can also see the eosinophilic cells with nuclear debris inside it. It points that about it is the apoptotic bodies. So it also favors the diagnosis of apoptosis is occurring in the cells. Okay, so I would like to point out that what are the apoptotic bodies seen in very conditions. For example, in hepatitis, we see the apoptotic bodies, councilman bodies. Okay, okay. Then in the lichen planus, we see the cavity bodies, which are the apoptotic bodies, also called as the colloid bodies, also called as the cytoid bodies. So cytoid bodies. So councilman bodies are the apoptotic bodies seen in the hepatitis. Cavity body, colloid body, or the cytoid bodies are the apoptotic bodies seen in the lichen planus. Another condition we know that is the Spitz navis, which is a benign melanoma. It is a benign melanoma, and in this condition we see another apoptotic body which is called as the camino body. Another condition in which we see the apoptotic body is the exposure to ultraviolet B rays that damage the keratinocyte, and the keratinocyte apoptotic body which where is called as sunburn cells. Okay, so these are the few examples of the apoptotic bodies. So in the histology of the apoptotic tissue, we see the earliest feature is the shrinkage of the cell, which is the earliest feature, and the late feature is the formation of the apoptotic blobs, while the characteristic feature is the chromatin condensation, which is the characteristic feature, which is also called as the pycnosis. We also can see the DNA fragmentation, and it is usually seen in the agarose gel electrophoresis, and the pattern which is seen is the ladder pattern. Okay, another thing I would like to highlight here is that when these apoptotic bodies has the molecule which is called as the phosphatidyl serine. It is called as the phosphatidyl serine. It is expressed on inside of the cells of the apoptotic cells. Okay, but there is one enzyme which is called as the sucrumlase. This enzyme's puts a hook at the phosphatidyl serine, and it exposes this phosphatidyl serine on the outside of the cells like this. And when this phosphatidyl serine is exposed on the external surface of the apoptotic cells, these are being easily identified by the macrophage, and macrophage comes and engulfs these apoptotic cells. Okay, and in this way these apoptotic cells are being engulfed by the macrophage without leaving any escape of intracellular contents outside the tissue, and thus producing no inflammation in the surrounding tissues. Okay, and these phosphatidylserine, which is expressed on the outside of the surface of these apoptotic cells, these can be identified by an assay which is called as the by an dye, which is annexin V dye. And when we give the tissue the annexin V dye, it stains these outer expressed phosphatidylserine molecules. So it is also annexin V assay also help in establishing the diagnosis of apoptosis. So how we can diagnose the apoptosis? By looking at the histology. By annexin V assay we can identify. By agrogel electrophoresis we can identify. Further, this nuclear condensation can be identified by staining the tissue with hematoxylin dye or flugin dye, or we can also look at the condensation by acridine orange dye. So in this way we can identify the or establish the diagnosis of apoptosis. We can also measure the level of Caspases. When we study the mechanism of apoptosis, we see that Caspases are involved in the process of apoptosis. So we can also estimate the levels of Caspases. If the levels are high, that means the apoptosis is there. Okay, and along with cytochrome C. Now I would like to highlight some of the differences between the apoptosis and the necrosis. So apoptosis, we know that it is the death of the single cell, while necrosis is the death of multiple cells. This is one point. It is the single cell, it is the multiple cells. Okay, it is single cell, it is the multiple cell. Here the cell membrane or the plasma membrane remain intact, while in necrosis it does not remain intact. Okay, this is another point. Another thing is that in apoptosis there is no inflammation, while in necrosis there is inflammation of the surrounding tissue. Okay, another thing is that in apoptosis there is cell shrinkage, while in necrosis there is cell swelling. Okay, so also the apoptosis can be physiological as well as it can be pathological, while necrosis is always pathological. Okay, also the apoptosis is the active process, while necrosis is the passive process. So the differences between apoptosis and necrosis is that apoptosis usually occur in a single cells, while the necrosis occur in the multiple cells, because when the cell membrane gets damaged in the one cells, it leaks its contents and initiate the inflammations, and also the surrounding tissue is involved in it. But in apoptosis, the plasma membrane remain intact, while in necrosis, it does not remain intact. So it induces the inflammation in the surrounding tissue. While in apoptosis, there is no inflammation of the surrounding tissue. While in apoptosis, we see that there is cell shrinkage, while in the necrosis, there is cell swelling. So also apoptosis can be physiological or pathological, while necrosis is always pathological. And also apoptosis is an active process, while necrosis is a passive process. Okay. It is active process because here the cell inside machinery of the cell works in it, while in the passive necrosis the outside damage that induces it. So it is the passive process. Now we will study the mechanism of apoptosis. Mechanism of apoptosis. How the apoptosis occur. To understand the mechanism of apoptosis, you should know that basically there occurs the two pathways for apoptosis to occur. One pathway is called the initiation pathway, and another pathway is the execution pathway. Okay. Initiation pathway is basically done by the initiate caspases. These caspases are the enzymes that are involved in the apoptosis, and these are the very, very important enzymes for the apoptosis to occur. While the execution pathway, it requires the execution caspases. The execution caspases are caspase 3 and caspase 7, while the initiate caspases are the caspase 8 and caspase 9. Okay. So basically the apoptosis is occurring by two mechanisms. One is the initiation pathway, which is done by the initiate caspases. Another is execution pathway, which is done by the execution caspases. So the initiation pathway is also called as the initiation phase, while the execution pathway is also called as the execution phase. So first we will study the initiation phase, then we study the execution phase. So let's take the initiation phase first. Initiation phase. In the initiation phase, it is occurring because of the two pathways, and one is the extrinsic pathway, which is working on the surface of the cells. Here it is working the extrinsic pathway, and another is working in the mitochondria, which is the intrinsic pathway. Okay, so basically the function of these initiation phase is to activate the initiative caspases, that is 8 and 9. How these are activated, let's see. In the mitochondria we have the anti-apoptotic proteins, which are BCL2 and BCLX. These are the anti-apoptotic proteins that do not allow apoptosis to occur in a normal healthy cells. But whenever there is an injurious to the cell, injurious stimulus, okay, whenever there is injurious stimulus to the cells, or when the cell is no longer needed by the body, or when the cell is harmful for the body, these anti-apoptotic proteins are being replaced by the pro-apoptotic proteins, which are BAX, BIM, BIM. There are a lot of pro-apoptotic proteins and anti-apoptotic proteins. I will discuss it later, but for the meanwhile you can remember that there are some anti-apoptotic proteins which are BCL2 and BCLX. When the injury comes or when the cell is not required by the body, these anti-apoptotic proteins are being replaced by the pro-apoptotic proteins, which are the BAX and BAC and BEAM. Okay, these are also called BH3 proteins, and when they are attaching to the mitochondrial outer surface membrane, on the mitochondrial membrane, on the inner mitochondrial membrane there are present the cytochrome C. Okay, this is cytochrome C. When these pro-apoptotic attaches to the outer membrane, these pro-apoptotic proteins induces the holes in the membranes, outer membranes, and the cytochrome C leaks out from the inner outer mitochondrial membrane to the outside of the and it reaches the cytoplasm. And in the cytoplasm, the cytochrome C combines with the apoptotic activating factor 1. Okay, this is apoptotic activating factor 1, and this cytochrome C and apoptotic factor 1, this complex is called as the apoptosome. This is called as the apoptosome. This then activates the caspase 9. Okay, this caspase 9 is activated. So whatever I am discussing, that cytochrome C, BAC, BEAM, cytochrome C, APOF1, caspase 9, apoptosome, these are all the pro-apoptotic factors. So you can also remember it from here. These are all pro-apoptotic. So this is the intrinsic pathway which is run by the mitochondria, where the mitochondria is increasing the permeability for cytochrome C, which is then combining with the APOF1 to form the apoptosome, which are then activating the caspase 9, which is the initiate caspase. So another caspase is caspase 8, which has to be activated, which is activated in the extrinsic pathway. In the extrinsic pathway, whenever there is induced stimulus comes, these receptors, death receptors, are expressed on the surface. The death receptors are FAS receptors, which is also called as the CD95 receptors. This is one death receptor. Another death receptor is tumor necrosis factor type 1, which is also the death receptors. And when this FAS ligand, whenever there is injury to the cell, when the cell is not required by the body, FAS ligand bind with the FAS receptors or the death receptors, and it activates the FAS associated domain. So these FAS receptor, FAS associated domain, FAS ligand, these are all the pro-apoptotic. They are trying to induce the apoptosis in the cells. So when the FAS associated domain gets activated, what happens, that this then activates the caspase 8. So in this way, the caspase 8 and caspase 9s are activated. So this is the initiation phase. Up to here there is initiation phase. Here initiation phase is carried out by the intrinsic pathway, which is done by the mitochondria, and the extrinsic pathway, which is done by the death receptors. Okay, the ultimate result of the initiation phase is to activate the caspase 8 and caspase 9. Then starts the execution phase. In the execution phase, these caspases 8 and 9 then activate the caspase 3 and caspase 7. Here starts the execution phase. That means now the real work is now going to be done. And when the caspase 3 and caspase 7s are activated, they start destroying the cytoskeleton of the DNA. This is the cytoskeleton of the DNA. This is getting destroyed and the cells start becoming loose. Okay, and along with the cytoskeleton, the nucleus also gets destroyed and DNA also gets destroyed. There occurs the DNA fragmentation, and which is usually done by the endonucleases. Endonucleases destroy the DNA. Endonucleases. Okay, and when it is destroyed, it leaks out the nuclear debris. These nuclear debris and the cytoskeleton then become loose and it engulfs these nuclear debris. Okay, like this. And this cytoskeleton is very eosinophilic along with nuclear debris inside it, and in this way it forms the apoptotic bodies like this. This is nuclear debris and with the eosinophilic cytoplasm. This is eosinophilic cytoplasm inside it. Okay, this is eosinophilic cytoplasm. So this apoptotic body has the phosphatidylserine on the inside, which is being expressed on the outside. I already discussed it. And when this phosphatidylserine is spread on the outside by the enzyme, which is the scrumlase. And when this phosphatidylserine is expressed on the outside surface, it is very easily recognized by the macrophage, and then this macrophage digests these cells and causes the phagocytosis of the apoptotic cell. Okay, so in this way apoptosis occurs. So to summarize, the mechanism of apoptosis occur by two phases. One is the initiation phase and another is the execution phase. In the initiation phase, the initiation caspases are activated, which are 8 and 9. In the execution phase, execution caspases are activated, which are 3 and 7. The initiation phase is run by two mechanisms. One is the intrinsic mechanism, which is done with the help of mitochondria, and another is the extrinsic mechanism, which is done by the Phage receptors. The ultimately role of this pathway is to activate the caspase 8 and caspase 9, which are the initiate caspase. When these are activated, there starts the real action, which is the execution phase, in which the caspase 3 and 7 are activated by these caspases 8 and 9. And when the caspases 3 and 7 are activated, they start destroying the nucleus of the DNA and also the cytoskeleton of the cells. And because the nucleus gets damaged, they form the nuclear debris, and because the cytoskeleton gets damaged, they form the cytoplasm of the apoptotic cells. Apoptotic cell has the very eosinophilic cytoplasm, and along with it the nuclear debris. And when these are formed, apoptotic cells are being phagocytosed by the macrophages with the help of the phosphatidylserine. This phosphatidylserine is being recognized by using the dye, which is the annexin B dye. Okay. Now I will tell you various pro-apoptotic and anti-apoptotic proteins. The anti-apoptotic proteins, you can remember it like this. Anti-apoptotic proteins are anything which has Cl in it is the anti-apoptotic, like BCL2, like BCLX, like MCL, and another flip protein. I will like to tell you something about the flip protein. This flip protein basically blocks the extrinsic pathway. Flip protein blocks the extrinsic pathway and thus acting as the anti-apoptotic. Okay, so the BCL2, BCLX and MCL are the flip proteins. They are the anti-apoptotic proteins. Another is IAPS. It is also the anti-apoptotic protein. Okay, so how you can remember this is anti-apoptotic BCL. I used to remember it like this. B stands for block, C stands for clearance. So clearance means this is the apoptosis. This clearance means apoptosis which is being blocked. So blocking an apoptosis means it's an anti-apoptotic. In this way you can remember if you forget it. Okay, and the pro-apoptotic proteins, you can remember it, which are having the BI or BA in it. That will be the pro-apoptotic. This is the pro-apoptotic. This is the pro-apoptotic. Pro-apoptotic. apoptotic. Okay, and you also remember that P53 is also pro-apoptotic, that induces the apoptosis. So pro-apoptotic proteins are also whatever being here is the pro-apoptotic, like cytochrome C, like back beam, cytochrome C, APOF1, Caspases. These are all pro-apoptotic proteins. Okay. Another very important point I would like to highlight here is that in neurons, these Caspases are not working to induce the apoptosis. What happens in the neurons? In the mitochondria of the neurons, there is the apoptosis inducing factor. This apoptosis inducing factor from the intermitochondrial space goes to the nucleus of the cells and then destroys the DNA of the cells. This happens in the neurons. Neurons do not have Caspase mechanism. So apoptosis inducing factor is also pro-apoptotic. Okay. Now we will discuss few MCQ regarding our topic. CD95 is a marker of, what is CD95? CD95 is a death receptor or the fast receptors we already discussed, and the death receptor is working in which pathway? It is working in the extrinsic pathway of apoptosis. So the right answer is CD95 is a marker of extrinsic pathway. So this is the right answer. So in the intrinsic pathway, it is working with the help of mitochondria, where the working in apoptotic proteins are the back and beam, okay, which are pro-apoptotic proteins, while where is Cl in it, BCl, BCl2, BClX, MCl, anything with Cl, that means it is blocking the clearance or blocking the apoptosis. That is the anti-apoptotic proteins. Okay. Then monocyte, leukocyte, they are not, CD95 marker is not for them. Another thing is all of the following are the features of the apoptosis except cellular swelling, nuclear compaction, intact cell membrane, cytoplasmic eosinophilia. So cellular swelling, I told you that it is the feature of necrosis, so it is not the right answer. So sorry, it is the right answer. The question is asking except. Nuclear compaction is a feature of apoptosis, I told you. Nuclear condensation or nuclear compaction, which is also called as the pycnosis, which can be seen by staining with hematoxylin, flugene or acrid orange. So it is a feature, nuclear compaction is a feature of apoptosis. This is right. Intact cell membrane, yes, it is a feature. In fact, it distinguishes it from the necrosis. Intact cell membrane is a feature of apoptosis. Also, cytoplasmic eosinophilia we can see in apoptosis, we can also see in necrosis as well. So the right answer here is the cellular swelling. Cellular swelling is seen in necrosis but not in the apoptosis. Then the execution caspase of apoptosis are 1 and 3, 8 and 9, 1 and 5, 3 and 7. So 8 and 9, I told you that these are the initiate caspases. So they can't be execution caspases. The execution caspases are 3 and 7, I already told you. Okay, right answer is 3 and 7. So annexin V is a marker of, I told you annexin V, basically this dye stains the phosphatidyl serine molecules present on the apoptotic cells. So it is a marker of apoptosis. Okay. Thanks for watching. If you like my video, please subscribe my channel. Thank you.